you today. In this occasion, we will learn about family-centered care in pediatric nursing. It is about improving care outcomes through collaboration with families. So, let's jump to the topic. So, first thing is, we have to know about definition of family-centered care. What is family-centered care, or FCC? FCC is a philosophy that recognizes the family as a constant in the child's life and partners with families to deliver holistic care. Let's talk about core components of FCC in pediatrics. There are 5 core components of FCC in pediatrics, including information sharing, tailoring roles, hearing caregiver voices, parent involvement in decision making, and negotiating roles. Information sharing. Information sharing is transparent, open communication between healthcare providers and families about the patient's condition, treatment options, and progress. The importance of information sharing is to ensure families are well informed to participate in the care process, fosters trust, and reduces anxiety by addressing uncertainties. The examples of information sharing, such as providing regular updates during rounds, using clear and jargon-free language, and offering educational materials. Tailoring roles. Tailoring roles is adapting the roles and responsibilities of caregivers and healthcare professionals to suit the unique needs and preferences of each family. It recognizes the individuality of families and accommodates their strengths, capacities, and cultural backgrounds. The examples of tailoring roles, such as allowing a parent to take on basic caregiving tasks if they wish, or having the healthcare team take a more active role if the family is overwhelmed. Hearing caregiver voices. Hearing caregiver voices is actively listening to the thoughts, concerns, and experiences of caregivers to incorporate their perspectives into care. It empowers caregivers, validates their role in the care process, and strengthens mutual respect. It can be done by providing opportunities for caregivers to express their concerns during meetings or creating anonymous feedback channels. Parent involvement in decision making. Parent involvement in decision making is actively including parents in the planning and decision-making processes for their child's care. It builds collaborative partnerships and ensures decisions align with the family's values and goals. It is encouraging parents to participate in care plan discussions or involving them in decisions about treatment options and discharge planning. Negotiating roles. Negotiating roles is establishing a shared understanding of responsibilities and expectations between families and healthcare providers. It prevents role confusion, reduces stress, and ensures care is seamless and efficient. It is clarifying who will perform specific tasks, such as feeding or administering medications, and adapting roles as the child's condition changes. By integrating these components, family-centered care creates a supportive and inclusive environment that enhances patient outcomes and strengthens the caregiver-provider relationship. The benefits of family-centered care in pediatric nursing are: 1. For children, better emotional, psychological, and physical health outcomes. 2. For families, increased satisfaction, reduced anxiety, improved coping. And 3. For healthcare, efficient use of resources, enhanced staff satisfaction. There are many challenges in implementing family-centered care, especially in pediatric. The barriers including lack of training and knowledge among nurses, high nurse-to-patient ratios, limited infrastructure for family involvement, and cultural barriers, differences in family roles across regions. Let's talk about global insights of family-centered care, or FCC, in practice. Many countries already implementing family-centered care in their health care, especially in pediatrics. Let's learn about how FCC is implemented in each country. First, Canada. In Canada, family-centered care is incorporated into healthcare policies across provinces. The healthcare system promotes family engagement in pediatric and neonatal care through structured communication, decision-making, and support systems for families. The neonatal intensive care units, NICUs, in Canada often encourage parents to participate in the care process, including skin-to-skin contact, kangaroo care, and decisions about treatment plans. Second, United States. In the U.S., family-centered care is a cornerstone of pediatric care, particularly in hospitals and specialized centers for children with chronic illnesses. It encourages family involvement in decision-making, providing education, and supporting families in coping with the patient's needs. The hospital includes parents in rounds, offers family support services, and provides family rooms where parents can stay close to their children. Third, Australia. In Australia, the healthcare system stresses the importance of families in pediatric and mental health care. Policies encourage family involvement in the planning and implementation of healthcare services, especially for children with disabilities and chronic health conditions. The hospital practices family-centered care by inviting families to participate in healthcare decisions, offering family accommodation facilities, and providing family support programs that include counseling and peer support networks for families of children with complex health needs. Fourth, United Kingdom. Family-centered care in the UK focuses on ensuring that families have access to the information they need and are involved in healthcare decisions, particularly in the National Health Service, NHS. It is about supporting the family as partners in care. The hospital encourages parents to be with their children 24/7, includes them in multidisciplinary meetings, and offers various support services to families, including social workers, family advisors, and a dedicated helpline for emotional support. 5th. Sweden. The Swedish system includes families in treatment planning and decision-making, recognizing their critical role in the recovery process. Hospital allows family members to be present during medical rounds and decision-making. Additionally, families are offered training and emotional support, particularly in the care of premature infants in neonatal intensive care units. 6. Japan. In Japan, family-centered care is primarily seen in pediatric and elderly care settings, where the family is regarded as a vital support system. The Japanese healthcare system emphasizes family participation in care, particularly in the context of chronic illness or when caring for elderly family members. Then, how about Indonesia? In Indonesia, family-centered care is increasingly being recognized as an essential aspect of healthcare, particularly in pediatric, maternal, and elderly care. Cultural context. Indonesian society traditionally places a high value on family ties. This cultural aspect aligns well with the principles of family-centered care, where family members are involved in the decision-making and caregiving processes. Healthcare system. The Indonesian healthcare system, particularly in government hospitals, has been making strides in improving patient care by encouraging family involvement. However, the level of implementation of family-centered care can vary depending on the hospital and region, especially between urban and rural areas. Recommendations for effective family-centered care for healthcare professionals include FCC training in nursing education. Advocate for policies supporting family participation. For institution, improve infrastructure to support family involvement. Offer continuing education programs. Family-centered care or FCC is essential for delivering holistic, effective pediatric care. So, let's work together to empower families and improve care outcomes. This is it for today's topic about family-centered care. Keep learning and thank you.